higher center exam. So I'm going to run through some things just to have a more comprehensive look, then we move on to the actual exam. So the higher centers, you are really trying to test the cortex, okay, which is the highest primal area of the brain. And so it's typically you are trying to test these areas, particularly especially the lobes and all the functions that equate the cortex. All right, so as with any higher center exam, you have to start with the initial assessment, okay? How is the patient appearing? Is he well? Is he unwell? Particularly look at how the patient is kept. Is he unkept? It looks disheveled, very dirty, very raggedy. Think about frontal lobe problems, okay? If the patient has notice, is he right-handed or left-handed? Remember, right-handed people, in 90% of the cases, the dominant hemisphere is on the left, and in only 10% is the dominant hemisphere on the right, okay? The left-handed, you literally have to flip a coin, because 50% will have the dominant hemisphere on the left, 50% will have the dominant hemisphere on the right, okay? So that's useful to know, because why do you want to know? Because remember, the dominant hemisphere typically deals with language, typically deals with mathematics, and this is what you typically use in school, right? The non-dominant lobe hemisphere deals mainly with visual arts, creative, and particularly what we call visual spatial, okay? So what's visual spatial? It's basically necessary for what you call spatial navigation, distance perception, and movement, okay? And that's why these people, if you have problem with visual spatial, you get what you call a neglect, okay? You tend to not have navigation of one area and you neglect it, one half of that area, what you call a hemi-neglect, okay? And finally, is the patient awake, alert? Is he communicating? Is he oriented to person, place, and time, okay? So that's very useful to know. Okay. Number two, I want to mention that please, for all science and purposes, remove speech from the higher center exam. Speech has nothing to do with the higher center. Speech is produced at the level of the mouth here, typically made by the cranial nerves, okay? So the cranial nerves are really the ones responsible for that, okay? So please remove the word speech. We use language, okay? So this is completely to be removed from the higher center exam. Language is a higher cortical thing. All right. Now, higher center exam has a lot of things, okay? You can test for parietal lobe function. Remember, the parietal lobe receives and processes somatosensory stimuli, whether it's now pain, touch, temperature, sense of limb position. And that's why you see the test there is for sensory inattention, because it receives and processes somatosensory stimuli, okay? You see spatial neglect, you can get that. Remember spatial navigation and all sorts of things. If you are looking at the dominant hemisphere, remember the dominant hemisphere has to do with especially mathematics and calculation. So you look for our calculi, left-right disorientation, okay? Non-dominant hemisphere will look for things like apraxias, which are not in the scope of today, okay? Temporal lobe function can also be examined, okay? Remember, the temporal lobe is to receive and process auditory stimuli, okay? So it mainly plays a role also in language and especially memory acquisition, and that's why you see most of the tests at the temporal lobe here, you're testing for immediate recall, short-term memory, and long-term memory, okay? Then the frontal lobe perhaps is one of the most common and most important one. Remember, it essentially, behavior comes from there, your personality, all things like reasoning, planning, language, long-term memory, all these things are controlled by the frontal lobe, and these are the things that you do. So that's why abstract thinking, for example, you do common proverbs, which again is controlled by the frontal lobe. So things like frontal lobe strokes or frontal lobe's dementia, you'd want to do certain things like this. Occipital lobe has nothing to do with the higher centers, okay? Remove it. Remember, the occipital lobe is mainly to deal with pretty much visual, whether it's receiving or interpreting it, visual, okay? And so that forms part of the cranial nerve exam essentially, okay? So please, higher center exams are a lot of exams there, okay? If the patient has dementia or you think he has neurocognitive disorder, you do things like mental status exam. Other things would depend on the clinical picture, okay? However, that is not the scope of today. How do you test for language? You say we look at 5 things. We want to know if someone is fluent, because if someone is not fluent, it means that they struggle to look for words. You can count the number of words they are saying. Okay, so like I 1, 2. You see, you can count that I've only mentioned 3 words and I'm struggling to find the words, so that indicates disfluency. Then the second thing that you test for is comprehension. Remember, comprehension is the ability to extract intended meaning from the language. So if I give a command, the patient is supposed to understand, interpret that, to comprehend it, and execute that. Okay, so if he can do that, then he can comprehend. Then repetition, then naming of common things, then reading and writing. Okay, now it's very easy to confuse terminologies, these three. Aphasia simply means there is difficulty in production or understanding language. So it's a disorder of language. As opposed to dysarthria is a difficulty in articulation. Okay, so that means the lesion is at the tongue or the palate, the mouth level. And that's why when you test for it, you say la 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 la, ma 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 ma, ga 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 ga. That is part of the cranial nerve exam.
It's Claire's birthday.
Claire's birthday? Today?
No, soon.
Oh.
Say, I'm going to get the birthday cake.
Well, that would be nice. What kind of birthday cake?
Chocolate.
Delicious. Is that your favourite?
As opposed to dysphonia. Dysphonia is difficulty in phonation. Okay, so it's much further back at the laryngeal areas there. Okay, so it's difficulty in phonation. Now let's take a look at some examples.
I have A, B, and AD, and I also have tremor. So whatever you can possibly get as far as SD, I have it.
To understand language and aphasia, you have to understand the basic anatomy. Remember, firstly, we have what we call the Wernicke's area. Okay, the Wernicke's area is typically located in the temporal lobe, particularly the posterior superior pole, as you are seeing it there, which is primarily responsible for language comprehension, which we have already discussed what it is. Thus, the problem in the Wernicke's area, if it's affected, we call it Wernicke's aphasia, or what we call receptive aphasia, what we call sensory aphasia. And then you need to understand that there is a Broca's area, which is found in the left inferior frontal lobe gyrus, okay, which is responsible for speech production, okay. And that's why the problem here is called Broca's aphasia, or what we call motor aphasia, or what we call expressive aphasia. And finally, there's this neural pathways linking the Broca's area and the Wernicke's area, also known as arcuate fasciculus. Okay, so this is responsible here to link the two areas to communicate for comprehension and the production of the speech. And so the area here, if it's affected, it's known as conduction aphasia. All right. Now, as looking at this, to understand aphasia as an undergrad is very easy. Firstly, we normally test for fluency. Remember, if the patient is fluent, which means he's not struggling with the words, you cannot count the number of words he's saying, is fine, it appears fluent, then the next thing that you do, so we are this wing, the red one, then the next thing you do is comprehending. So if someone is fluent, okay, what we call is speaking very fluently, but he's speaking nonsense. That is the general summarization. He's speaking well, but it's completely nonsensical, or it's not part of what you ask the person, so it cannot comprehend. That, in all senses, is what we call Wernicke's aphasia.
Hi, Byron. How are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talked with the people for them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon for him. With luck for him.
So we're on a cruise and we're about to
We
get to
will
Juneau.
store it right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
Right at the moment they don't show a darn thing.
With the iPad that we were doing. Like here?
I'd like my change for me and change hands for me.
Okay, as opposed to the patient is struggling to find words, he's struggling to, you can count the number of words, but he's actually speaking sense. He can comprehend, right? Because he understands, right? That is what we call Broca's aphasia.
Can you tell us your name?
Mike Caputo.
And Mike, when was your stroke?
I was 7 years ago,
Okay.
and
what did you used to do?
worked Autodesk, seven sales, and worldwide, and very good. Yeah,
Okay. And who are you looking at over there when you turn your
that's
head?
my wife.
Okay. And why is she helping you to talk?
She's a speech.
So you have trouble with your speech.
Yeah.
And what's that called?
Aphasia.
All right.
There are a number of other aphasias you are located there, but at least for undergrad, no Venix aphasia, no Broca's aphasia. And the last one that I'm going to mention here is what we call global aphasia, which means simply both the motor, the Broca's, both the receptive, the Venix are affected. Okay, so the patient is not fluent, the patient cannot comprehend, and the patient has poor repetition. Okay, so the whole entire pathway is affected, and that's what we call global aphasia. And so let's take a look at some examples.
All right, say hi.
Hi.
What's your name?
What?
What's your name? Do you know? Jean?
Jean?
Jean.
Yeah. Jean.
Yeah. What's my name?
What's whose name?
My name.
Hard to get them all.
Yeah. Amanda.
Yeah.
Yeah. Do you know where you are?
Do I know who it is?
Do you know where we are?
No, you live in the park.
Close. We're at the hospital.
Yeah.
Yeah.
Who am I?
Who's that?
Who's?
Who is that? What do you call her?
What do I call them?
What do you call her? Do you call her Deb? Or Babe?
Can't remember her name.
Or Honey Bunny? Okay. That's
Who
okay.
am I? Am I your wife?
You? They're the wife.
Yes.
Yeah.
That's your wife.
And
I'm your daughter.
yeah.
Yeah.
Good day, Mr. Israel. Could you please do a focused higher center exam on this patient? Good day, ma'am. How are you?
Fine, how are you?
Good. My name is Israel Shingenge. I've been asked by a doctor to do a higher center exam. It will involve me looking at you and telling you to do some comments. Is it okay with you?
Yes, that's fine.
Can I have your name?
Violet and Pandora.
Okay, what level of education are you now?
Third year medical student.
Okay, so you're a fifth year medical student. Are you right-handed or left-handed?
Right-handed.
You are right-handed. Okay, so it's useful to have some bio data, especially on handedness and level of education, just so you tailor your exam towards that. So it's very useful. Okay, then of course, as you start with your examination, you want to look at the patient. What's the level of consciousness? Is the patient awake? Ma'am, do you know where you are?
Yes, I do.
Okay.
I'm in the hospital right now.
Okay, what time of the day is this?
Nighttime.
Okay, so we know that the patient is oriented to time, to place, and to person. Okay, and he's fully awake. We don't see any obvious decreased level of consciousness. All right, so the first thing that we're going to test for is, always remember, we typically test higher centers, especially in our setting for stroke. Okay, remember, if someone has a right-sided weakness, you are probably dealing with a left-sided stroke. If you have a left-sided weakness, you are probably dealing with a right-sided stroke. And remember, and since this patient is right-handed, in 90% of the cases, his head dominant hemisphere will be on the left. Okay, that's where you typically test for language. That's why if someone asks you, what do you test for if you have a right-sided hemiplegia, you test for language, because the stroke will be on the left. Okay, and the opposite is true. If you have a left-sided hemiplegia, you test for your visual spatial, which is in your non-dominant hemisphere. All right. Okay, so we are going to start this off with language. So remember, you test for language if you're having a right-sided hemiplegia, for example, okay? Because you're assuming the pathology is on the left, which is your dominant hemisphere in most right-handed people. Okay, remember, language has 5 modalities: fluency, comprehension, repetition, naming, and reading and writing. Okay, we'll start off with fluency. Okay, remember, as I'm going to ask the patient, try to see if you can count the number of words the patient is. The patient having word finding difficulty, grammar. Take note if he has any neologism or paraphasias. Okay, so ma'am, I'm going to ask you, tell me about your birthday. Just tell me about it.
Okay, my birthday was last month. I didn't have anything planned. However, a few of my friends decided to surprise me. They planned several surprises that day. One of them got me something I've always wanted, and the other bought me some of my favorite things. And my mom and my sister also came to visit me, and they brought me gifts as well.
Okay, so the patient has given us a short description, and we could really hear that we couldn't count the number of words. He said so many words, and we could not appreciate any obvious sign of word finding difficulty or any grammatic error. Is fluent. Then we move on to comprehension. Okay, remember, comprehension, you are trying to do a 3-step command that crosses the midline. Before, remember, comprehension, your main aim is to do a 3-step command, which will show very soon. However, you don't start with this 3-step command. Always start with simple command, then build up to the one that you want. Okay, so firstly, you can just tell the patient, shut your eyes. Okay, then they shut their eyes. Okay, can you touch your nose? Okay, then they touch the nose. Okay, can you take your left hand and touch your right ear? Can you see I build up from a 1-step command to a 2-step command? Then only you do the 3-step command, which will show you now. So ma'am, I'm going to ask you to take your right hand, you put it to your left ear, and you stick out your tongue. Okay, so we know the patient can comprehend. Remember, aphasia, what we are trying to find here, if the patient has dysphagia, what we call aphasia. Okay, and remember, we know the patient is fluent, we know the patient can comprehend. We can move on to repetition. Okay, repetition, the trick with repetition is that you want to give a statement that the patient first has to think about it before he can just spontaneously repeat it. Okay, so you don't say dog, dog, cat, cat. No, you say something like, ma'am, could you please repeat after this? Birds fly into close to windows when the room is dark.
Birds fly into closed windows when the room is dark.
Good. No ifs, and or buts. No ifs, and or buts. Okay, repeat.
No ifs, ands, or buts.
Okay, so we know the patient can repeat. Okay, then we move on to naming. Okay, you can start with common things. Okay, ma'am, what color is this?
Red.
What color is this?
Pink.
What color is this?
Yellow.
Okay, so we know the patient can name colors. We can move on to body parts. Okay, what is this?
Ear. Nose. Mouth.
Okay, and finally, you can move the patient to name objects around the room. Okay, what is that?
A chair.
Okay,
Couch.
okay,
A wall. Ceiling.
all right. Okay, so we know the patient can name. And finally, you can mention that you ideally we will test for reading and writing, which you can ask the patient to write or read. Okay. Okay, now we are moving on to our non-dominant hemisphere. Remember, non-dominant hemisphere, this is where you test for especially visual spatial. However, they can have other abnormalities such as apraxias. However, today we are going to do test for visual spatial. Okay, so we want to pick up what we call a hemi-neglect. So that means the patient is neglecting one half of whatever we are going to draw in this demonstration. Okay, so ma'am, I'm going to ask you, so what you want to do is to typically there are many ways to do this. You can draw a clock, you can draw a line, but it's always advised to give the patient a bit of orientation. So write in your 12, your 6, your 3 and 9 just to give the patient orientation, and then you tell the patient to fill in the numbers. Ma'am, could you please fill in the numbers in the clock? Okay, so we can see that the patient can feel the numbers very well. There's no side that was neglected, and so there's no obvious hemi neglect. Okay. And the other thing that you can do is, ma'am, could you please transect those 3 lines exactly in the middle as much as possible? And again, we can see the patient can transect the lines well in the midline, and so we do not see any obvious signs of hemi neglect. Okay, there are a number of ways that you can test, obviously, for visual spatial. One of the other ways, again, is to draw an image. You can see 2 trees on the left and 2 trees on the right and a house in the middle, and you tell the patient to copy that image. And you can see very well that that patient that copied down, you can see the house is more developed on the right as opposed to the left. You can see he has drawn the 2 trees on the right, however, he's completely neglected the left side and there are no trees copied, and that will indicate a left hemi neglect. Alright, so thank you very much, ma'am, for your time. This brings us to the end of the higher center examination. Remember, there are other things. The mental state exam is part of the higher centers. You can test also for your cerebral hemispheres, okay, for parietal lobe problems, frontal lobe problems, temporal. However, it's not part of the scope of this, okay. The key giveaway here is that if you're having a right-sided hemiplegia, think about testing for language, okay? If you're having a left-sided hemiplegia, think about testing for your visual spatial. And always remember that in 90% of right-handed people, your dominant hemisphere will be on the left, okay? However, it gets tricky in left-handed people where you literally have to flip a coin. 50% will have the dominant hemisphere on the left, 50% will have the dominant hemisphere on the right. I thank you.